Hey everyone, I'm Abby Sharp. Welcome to Abby's Kitchen. As you can surely guess, we are practicing serious social distancing up here in Canada. My family's being pretty conservative and we're completely isolating despite being healthy and well. It's really scary times for all of us, and I know we're all juggling a lot, but I want you to know that I'm going to try to the best of my ability to continue with my usual posting schedule to give you all some much needed entertainment and education. Having said that, please keep in mind that my videographer is obviously no longer with me, so I'm having to try to navigate this whole thing on my own, which is a skill that I honestly don't really have. So please bear with me as I stumble through this, and maybe the quality is not as good as usual, but I'm just going to try to do my best and hope that it's relatively watchable for you guys. Now, today I wanted to discuss in detail the risks and safety of different modes of getting your family food. Now, there's been a lot of questions on my feed about grocery shopping versus delivery versus takeout during this coronavirus outbreak. And I really want to talk about how ultimately to keep yourself fed, safe, and still sane. So we dove into the actual research and the official recommendations to help you determine the safest way to get food into your house. Now, as always, my general disclaimer that the information in this video is for education and entertainment purposes only and is not in any way intended to prescribe or diagnose, so please always reach out and speak to a healthcare professional about your unique situation. Also, considering the evidence is changing literally daily in this situation, I did want to flag that I'm doing my best to bring you up-to-date information, but by the time that this gets up or by the time that you watch it, things may change. So always keep an eye on the CDC and other health authorities for the most up-to-date recommendations. Okay, so first things first, let's get into this. I wanted to cover the question, can COVID-19 be transmitted through food? Now, given the rapid spread of coronavirus worldwide, there's no surprise that there's been mounting concerns about potentially ingesting food that has come in contact with COVID-19. However, according to multiple health and safety organizations around the globe, including Health Canada, the Centre for Disease Control and Prevention, the European Food Safety Authority, and the US Department of Agriculture, there is currently no evidence to suggest that food is a likely route of transmission for COVID-19. Now, even though we don't know this for sure, as the evidence on COVID-19 continues to develop every single day, the latest research suggests that COVID-19 does not typically fit models of foodborne outbreaks. According to the FDA, a virus can only be classified as foodborne when 2 or more people get the same illness from the same contaminated food or drink. As of this date, there has not been a single positive case of the virus that has been linked specifically to food. In fact, a study done in Singapore investigated a group of individuals with confirmed cases of COVID-19 to assess possible modes of transmission. Through an extensive interview process, the study found that all cases could be traced back to local transmission through clusters of people, including a tour group, a conference, and a church gathering. None from contaminated food. There were some early reports that suggested that even if you did ingest the virus through contaminated food, stomach acid should efficiently and effectively inactivate the virus. However, it appears that this may not be true, as early research has shown that some cases of COVID-19 present with digestive symptoms like diarrhea and a lack of appetite, leading us to believe that the virus may have some effect on the gastrointestinal tract. However, like I said, research in this area is very limited, and further studies on the effects of COVID-19 on the digestive system is definitely necessary before we can make any kind of further claims. Now, even though there is limited data on how long coronavirus can last on food, what we do know is that the virus remains more stable on non-porous surfaces like metals and plastics and breaks down faster on organic surfaces like cardboard and food. It's also important to consider that we all eat multiple times in a day, and if there was a really strong link between food and the coronavirus transmission, it would likely have been detected by now. But what about food packaging? Now, even though there is currently no evidence to suggest that food packaging is associated with the transmission of COVID-19, food packages could potentially carry the virus if it has come in contact with an infected person. Having said that, Experts suggest that the risk of transmission is still relatively low compared with other exposure routes like person-to-person contact, which is far more likely. You are actually way more likely to become infected when interacting with a worker handling the food than from the food or food packaging itself. Now, according to the latest research, the coronavirus is able to remain viable for hours and up to several days on some surfaces, including copper for up to 4 hours, cardboard for up to 24 hours, stainless steel for up to 3 days, and plastic for up to 3 days. This means that if a delivery person or package handler infected with COVID-19 were to cough or sneeze on a plastic takeout package, the virus could, in theory, be able to stay on the package for several days afterwards. Now, before we get into what to do about these risks, I want to talk about what that means for you in the grocery store, getting takeout, or ordering delivery. Now let's start with grocery shopping in the store. The truth is, if you're regularly grocery shopping in a busy store, there is some risk there. The biggest risk is that you may be exposed to large crowds of people who may be infected with the virus, even though they may not be showing any signs and they feel healthy. It's also possible that an infected person may end up coughing or sneezing on grocery carts, food items, or in checkout lines, which again can increase your risk. But we all need to eat, and most people do not have a stockpile of food in their home to last them the weeks or potentially months that this thing is going to last. So if you are the designated shopper in the house, here are some tips to help reduce your risk. Number 1, go to the grocery store as infrequently as you can manage. Plan your meals so that you know exactly what you're going to need for at least a full week so that you don't have to return to the store several times. I know that this can be really hard for us, and as the nutritional gatekeeper in my home, this has actually been particularly stressful for me. But I have been setting aside like a half day every Sunday for this specific job to come up with really simple recipes for all the meals of the day and a thorough list of what is needed for each. Number 2, go to the grocery store at off-peak times and avoid crowds. So that means going really early in the morning or really late at night. Number 3, bring gloves, disinfectant wipes, and/or hand sanitizer with you. That way you can wipe down the cart handle with a disinfectant wipe, wear gloves for anything that you might touch like a keypad or door handle, and apply hand sanitizer immediately after leaving the store. It might seem like overkill, yes, but it doesn't take that much energy to just take these extra little precautions. Number 4, minimize contact with grocery items by following the you touch it, you buy it rule, which basically means no squeezing and sampling grapes to make sure that they're firm. Number 5, avoid touching your face, mouth, eyes, and nose, which I find is easier to remember when you're wearing gloves. Number 6, keep a distance of at least 6 feet apart from the people around you and while waiting in line. Some stores have actually begun to ensure that shoppers stay 6 feet apart by making these measurements on the ground. Number 7, if available, use self-checkout to reduce contact with other people. I would say, of course, be mindful of touchscreen displays and barcode scanners, and be sure to sanitize your hands after each use or wear disposable gloves that you can throw out immediately upon leaving the store. Number 8, bring your own reusable grocery bags and bag your own groceries instead of having them handled by another person. Number 9, avoid using cash and use tap transactions if possible. Number 10, wash your hands thoroughly as soon as you get home. 11, use package disinfectant strategies and take safe food preparation precautions, which I'm going to talk more about momentarily. And 12, most importantly, do not go to the grocery store if you're showing any symptoms of COVID-19 or suspect that you've been exposed in some way to the virus. Now, what about grocery delivery or grocery pickup options? So if you do not feel comfortable going to the grocery store, or you maybe are already sick and 100% need to be staying home, you may have access to online grocery delivery services in your area, or you may also be able to request to have your groceries picked up directly from the store. The downside of this is that a lot of people right now are finding that these grocery delivery apps and pickup apps are severely backed up. So if you don't plan your menu and list like a week in advance or more, you might be out of luck. Also, this tends to entail, having another human shop for your groceries, bag them, and then either you pick them up at the store, having paid online, or they safe drop them at your door. And the benefit of this is that you don't have to go into the grocery store, which is particularly important if you yourself are sick so that you don't infect others. But what if your shopper was unknowingly sick? Are there any extra precautions that you should be taking in this case? This is where you may want to employ some extra disinfectant and food safety precautions, which I'm going to be talking more about in a lot more detail in just a moment. Now, let's talk about the risk when it comes to restaurant takeout and food delivery. While many of us are fortunate enough to work from home or take a leave of absence from work to really limit our exposure to the outside world, food service workers still have to get up and go to work every day to provide us access to takeout and delivery services. However, there have been a lot of concerns raised around the safety and risks of ordering takeout and food delivery. I mean, what if a delivery driver has coronavirus and touches my meal? What if the line cook has COVID-19 and is preparing my food? Well, at this moment, and this is changing rapidly by the day, we don't have current research to suggest that takeout or drive-through meals are a high risk for transmitting coronavirus. It's obviously way safer than eating in a restaurant, which none of us can do right now anyways because they've all been mandated to close. But takeout and food delivery limits the amount of social contact and thereby makes it easier to maintain social distance from other individuals potentially infected with the virus. Many delivery services now also have implemented practices that limit the amount of contact one person might have with a delivery person in order to further reduce the risk. So for example, many online ordering services like Uber Eats have implemented contactless deliveries, allowing the option to leave deliveries at the door. Other drive-through and takeout services have also gone completely cashless and use touch-free or card-only transactions. But as we've already discussed, current research does suggest that the risk of infection from touching food or packaging that has been exposed to the virus is relatively low. Having said that, if you have any concerns about the early state of this research and want to take some extra precautions to further minimize the risk of possible infection, you can follow these steps when ordering food through takeout or food delivery. Number 1, handle takeout and delivery packages with gloves. Number 2, remove the food from the packaging. Number 3, immediately dispose of the food packaging. 4, transfer the food using tongs or spoons to a clean plate or container. 5, safely dispose of the gloves. 6, wash your hands with soap and water for 20 seconds before eating. And 7, reheat your food if possible, which I'll talk a little bit more about in a moment, but you can also avoid kind of raw salad bar types of food that can't be cooked and may be sitting out in the open where others can potentially sneeze or cough on them. Okay, so you now know the risk is relatively low, especially for delivery and takeout options, but how can we sterilize packages and food to further reduce our risk? Now, current evidence suggests that the best way to disinfect surfaces, including any food boxes, bottles, and cans, is to use either soap and water, ideally a dish detergent, diluted household bleach solutions, alcohol solutions with at least 70% alcohol, or store-bought disinfectant wipes. As for our foods, the exact temperatures and times for disinfecting foods that may have come in contact with COVID-19 is still being researched. However, scientists suggest that a temperature of 149 Fahrenheit or 65 Celsius for at least 3 minutes is sufficient. Other heating methods to kill viruses and bacteria from food include heating liquids like soups, stews, and sauces to a brief simmer and making sure to stir frequently so that they're heated evenly throughout. Or you can microwave food until piping hot. For most microwaves, this is usually about 90 seconds on high heat. So what does that look like for food that you bring into the house? Again, the current research suggests that food and food packaging is likely very low risk, but here are some precautions that you can maybe take to make sure everything is fully safe to eat. Number 1, wash any produce under cool running water with a vegetable brush, making sure to regularly clean the brush with soap and water. 2, wipe down any cardboard packages with an alcohol solution of 70% alcohol or higher, a diluted bleach solution, or disinfectant wipes. Number 3, cook anything that you can't wash thoroughly to at least 149 Fahrenheit for at least 3 minutes. 4, reheat any prepared foods for 90 seconds on high in the microwave. 5, purchase any raw produce when you can in a sealed package, like bagged or boxed salad greens rather than loose, and be sure to disinfect the packaging before storing. The bottom line is that there is a relatively low risk of contracting the virus from the food supply or through takeout or delivery services. Ultimately, your risk of infection of COVID-19 is dependent on your interaction and proximity to individuals who may be potentially infected with the virus. That is why social distancing is so important and should be considered when making food decisions. A good rule of thumb is to always consider the ways that you can minimize the amount of touch points with other people, as this is the best way to reduce your risk of exposure to the virus. From this perspective, food delivery, whether it's delivery of prepared foods or grocery delivery, would have the least amount of risk as you're only making contact with one person. You can also specify no contact rules with your order by having the delivery person just drop off the food at your door, and you may have the option to pay online to avoid paying at the door as well. Though still considered relatively low risk, picking up takeout orders or groceries would have a higher amount of risk in comparison to delivery, as there are just more touch points involved. Touch points may include things like driving or taking public transit, opening doors, exposure to crowded environments, waiting in line, interacting with food service workers or cashiers, and making a payment. Even though the current early research we have does not suggest that food is a high-risk transporter of the virus, you can always take some of these extra precautions with food that you bring into the house to further minimize your risk. Now, I hope that you can all use this information to make mindful decisions and that they bring you a sense of control rather than more anxiety about food. There's already so much anxiety around food, which I'm going to be talking about in another video very soon. But until then, I would love to hear how you guys are all doing. So leave me a comment below, like this video, subscribe. Let me know if you'd like to see more COVID-19 videos or more of my regular types of videos or like a mix of the both. I am fully open and I'm going to try to keep up with the demand despite this more challenging setup for me. Okay, folks, that is all for me today. Take care and chat soon. Bye.